Hello everyone and welcome to Module 9, Day 2. If you can believe it, we are just now 2 short weeks away from the end of your quarter here. So again, this week our main focus will be on, like we talked about, medical emergencies and assisting in those situations, which is going to refer to Chapter 43. Just like in Day 1, Day 2, Heart Solutions will be back again to teach you, but this time they're going to be teaching you about first aid. So please, again, make sure that you are coming to class, you are on time for that 8 a.m. start time, so that way Heart Solutions can get going, as this lesson can take quite a bit of time as well. So to start the day, I want to do a little review, see what you guys remember from our discussion on Day 1 when we started talking about medical emergencies, and some that you might encounter. Those things could be anything that would need CPR. If you remember, Day 1 we had Heart Solutions in, and they taught you guys all about CPR and how to handle situations that need CPR. We also talked about dealing with respiratory distress, chest pain, and shock, knowing the signs and symptoms of those and how to help with them. We talked about your responsibilities as a medical assistant during certain emergencies. We also learned about the Good Samaritan law and what that means, as well as we talked about what an emergency crash cart is, what medications will be on it, and what supplies should be there as well. So with first aid, some of the things that we need to talk about are in emergencies that you might encounter. First aid is the assistance given to any person suffering from a sudden illness or injury, with care provided to preserve life, prevent the condition from worsening, or promote recovery. Some situations that you may offer first aid care to are patients who are bleeding, have open wounds, soft tissue injuries, or burns. So we're going to take a few minutes and look at all of those a little bit further and have a little bit more of a discussion on them. So we're going to start talking about bleeding. So bleeding can either be external or internal. External bleeding occurs when the skin is broken. This type of bleeding can be controlled. You want to apply a pressure bandage around the injured part and maintain pressure on the site. Now, if the blood does seep through the original dressing, you want to apply more bandages to the top of the old bandages. You never want to remove that first bandage. When you remove the first bandage, what happens is you break the clot and the bleeding will get worse. So instead, you keep adding pressure bandages on and applying pressure. Now, internal bleeding, on the other hand, is bleeding that occurs within the tissues and damages the intact skin. This type is very unlikely to be diagnosed outside of a medical office because of the fact, or maybe even inside of a medical office, it's hard to diagnose it because you need to have image studies done. You can't just determine that there's internal bleeding without having the visual aid of what's inside the body. Open wounds are next, and these are seldom life-threatening unless they penetrate the head, chest, throat, or abdomen. Because there are so many vital organs in those areas, if the open wound is bad enough, it could cause damage. If you come in contact with a person who has a head, chest, throat, or abdomen open wound, please contact EMS and the paramedics right away. Now, as a medical assistant, one thing that you can do is always try to control the bleeding for a patient. Most of the time, if the injury is not life-threatening, it will need to be irrigated with water, preferably distilled water. You'll need to do debridement, which is you want to remove any sort of foreign object that you can physically see. You'll want to suture the area or staple it depending on the severity, and put in antibiotics and use oral antibiotics for care and prevention of infection. When you're dealing with open wounds, there are some wound care pointers that you need to follow. Could be things such as apply a dressing. This is a sterile covering that's placed directly over an open wound to absorb any blood or other bodily tissue or fluid. And you always want to apply a bandage, which is a strap of binding material used to hold the dressing in place. So you want to place the gauze on, and then you'll place the dressing or the bandage around it. Could be things such as rolling gauze wrap, elastic bandages like an ACE wrap, or you could even use Coban, which is a self-adhesive bandage. Next, we have our soft tissue injuries. This is where trauma has occurred that involves both the skin and underlying tissues. For tissue injuries, you will want to elevate the body part above the heart and apply a cold pack. Always apply a cold pack. The typical soft tissue injuries we see are typically around the knee or the ankle. Could also be a sprain in the wrist or fingers. If the injury is more severe, you always want to make sure to immobilize it. If you have an immobilizer, that's perfect. If you don't, use what's in nature around you. Maybe it's a stick or a piece of wood or a cardboard box, something to keep the injured area stable and so it doesn't move on you. And lastly, we have burns. Now, this is a type of injury that occurs when the area of tissue is destroyed by the actions of physical heat, chemical activity, high electrical current, or heavy exposure to radon or radiation. The severity of the burn will depend on the amount and the depth of the tissue injured. As you can see in the picture, you have first-degree burns, second-degree burns, and third-degree burns. First-degree burns are typically just at that surface level. The hand may turn red or have a little bit of blistering, but not much. Second, we'll go through the epidermis and the dermis layer. This will actually cause those blisters that we all know of, and there will be severe burning with it. And the third-degree burns are where you injure the epidermis, the dermis, and the hypodermis. You're actually getting down to where your bone and your muscles are, and you've actually burned it pretty well at that point. When you're treating a burn, you always want to use cool water to soothe the area if there's no broken skin or blisters. If the skin is broken or blistered, you do not want to put cool water onto it. That will make the burn worse. Burn should be addressed with a sterile, dry bandage, and the pain should be managed with injectable medications only if ordered by a prescriber or a doctor. You don't want to apply any sort of like Neosporin onto them or any sort of creams, because what that does is it actually keeps the heat inside of the burn instead of allowing it out, so that way the patient can heal. Alright, so that is actually where I'm going to stop and leave the rest of the chapter up to you to read and review. Again, Heart Solutions will be back on day 2 to teach you about first aid and your roles during that, so you need to make sure that you are on time to class at 8 a.m. This is so important because it's important for your training, but it's also a respect thing for not only the individual we have coming from Heart Solutions that will be teaching you and taking time out of their day to teach you, but this is also a respect thing for your classmates and myself. So please, again, make sure that you arrive to class on time, 8 a.m., day 2, and we'll be learning about first aid. And at the end of the day, on day 2, you will be certified in both first aid and CPR. Thanks, guys, and have a wonderful week. Bye-bye.